New studies show cancer patients may only require immunotherapy for treatment. Results from various clinical trials have shown that some patients with locally advanced cancer may only need immunotherapy. In this episode, we will try to understand when a patient may need immunotherapy. But first, please like the video and subscribe to our channel for more such content in the future. Push the bell icon to receive updates every time you upload a video. Tumors restricted to their original location or nearby lymph nodes may opt for immunotherapy. Scientists and researchers are of the opinion that more studies and clinical trials are required to get conclusive results on the effectiveness of immunotherapy for locally advanced cancer patients. While it is true that researchers are encouraged with the results so far, it will take some more time before this treatment becomes a regular part of cancer care. 35 patients agreed to be a part of a clinical trial held recently at MD Anderson Cancer Center. Most patients in the clinical trial had locally advanced colorectal cancer. Close to half the patients received the immune checkpoint inhibitor for 6 months. Please check the description box to find the episode on checkpoint inhibitors and how they work. A significant portion of the tumor had disappeared and what was left was removed surgically, post which the patients had no trace of cancer. The other half was treated with pembrolizumab, another form of immunotherapy, for a year. The patients did not require further medical attention. An article published on the National Cancer Institute mentions the following. The other participants were treated with pembrolizumab for up to a year, but otherwise had no further treatment. All but one of the 18 patients in this group had at least a substantial reduction in the size of their tumors, based on imaging scans within 24 weeks of starting immunotherapy. Many had no evidence of cancer at all.
So immunotherapy is relatively a newer technique of cancer treatment in which the drugs that are given enhances the immune system of your own body to fight against cancer. So is immunotherapy for all cancers? No, and definitely not for all cancers. But for patients who are eligible to get immunotherapy, do very well with immunotherapy. The traditional side effects of chemotherapy, that is the nausea, vomiting, hair loss, are usually not seen with immunotherapy.
When can immunotherapy be used as a standalone treatment? Neoadjuvant treatment is a kind of therapy that is of particular interest to researchers. Generally, patients with locally advanced cancer are advised to receive the treatment before surgery. Neoadjuvant therapy significantly shrinks the size of tumors before being surgically removed. While the results of immunotherapy becoming a standalone treatment for locally advanced cancer are on the horizon, more research needs to be conducted. In the next episode, we will explore another story from the world of cancer research.
It's really a remarkable change that's going on in the world of adjuvant and neoadjuvant treatment for colon cancer. In the adjuvant setting, the biggest story is around ctDNA, minimal residual disease testing, and how to incorporate that into decision making, both prospective trials and experiential studies. In the US, we're incorporating it very quickly, but are we doing the right thing? So more data being presented.
How did you find this information? Please mention this in the comment section. We would also like to know the kind of content you want to watch, and we will try to create it for you. For more news and updates, follow Airr News.